But certainly, as a collective, we have had great challenges in the last year, but we have made great gains, and that is really thanks to the hard work of the NLMA staff and our members. Our staff worked tirelessly on our behalf, and this resulted not only in what I think most physicians would consider a very successful resolution to our negotiations, but also resulted in the winning of both national and international awards by Jonathan Carpenter and Lynn Barter for our ad campaign, How Much Time is Lost Waiting? We Need More Doctors in Newfoundland and Labrador, and I'd just like everyone to congratulate them. I certainly think that the gentleman who draws the cartoons in the Telegram also deserves an award for his renditions of that ad campaign depicting people other than patients. Certainly, though, when I reflect on the events of last fall, what stands out to me more than anything is the level of support that the NLMA and physicians receive from the public and our patients. And this is where I'll try not to get teary, because without a doubt, a major factor in the success of our negotiations, and probably the most significant factor, was the extent to which physicians were able to retain the public support. When my colleagues and I made the difficult decision to announce our resignations, which we have obviously since rescinded, at the request of the Newfoundland government, we worried that it may, probably our biggest worry was that it would result in the loss of trust that we really felt our patients had in us. But really the opposite occurred. They believed in our cause, and they rallied behind us, and they gave us our support. I had no idea, really, about the impact that we as physicians have on our patients' lives. I was truly humbled by the number of families and patients who sent me cards or dropped by my office to express their gratitude to the role that I had played in their children's lives. They wanted to take my picture. I mean, it was really, really overwhelming. And I was pretty strong through all this, even through my husband's fear. But it really was the patient's response that I found the most supportive, but also the hardest, because it looked like I was going to have to leave them. We made the decision to take a stand, not out of self-interest, but on the belief that our patients deserve better, that a lack of physician resources means that we are unable to provide our patients with the highest quality care that they need and deserve. This resonated with the public, and I believe that the majority of the people of the province really understand that in order to stabilize the physician workforce in this province, we need to be competitive. Each year, on our behalf, Corporate Research Associated polls residents of the province to gauge physician reputation. And prior to our negotiation campaign, apparently 71% of those polled held a favorable opinion of doctors in the province. Following our campaign, that number rose to 80%. If it goes up any more during this year, I may run for political office. Of a different kind. Then my husband will truly be afraid. All jokes aside, we are very privileged to be in this position, and we have a duty to maintain this very high level of confidence that the public has in us. Patients today are well informed. They have high expectations when it comes to their medical care, and so they should. As well, politicians and the public are demanding greater scrutiny of the medical profession. We're seeing it all across the country and here at home with the introduction of legislation like the new Act Respecting the Practice of Medicine and new obligations outlined in the Personal Health Information Act. In the coming years, we expect to see increased monitoring measures, such as shadow billing for salaried physicians to be occurring. The underlying objectives of these types of legislations are good for the profession because they have the best interest of our patients and the public. If we intend to preserve the public's confidence, we need to be recognized as proactively leading progressive change by taking a leadership role in endorsing and advancing transparency and accountability. Progressive change starts with getting our own house in order and building a stronger organization. A big part of the year ahead is to move forward with our strategic planning and our governance review to guide the NLMA into the future. The first step is to redefine the mission of the NLMA and the values that drive this organization. Next, we'll need to reevaluate our association's current governance arrangements, organizational structures, and mechanisms for physician representation. To accomplish this, we need members to be engaged in the activities of our association. The NLMA needs to increase its outreach activities and promote opportunities for members to become involved. The NLMA is the forum that brings us together as physicians so that we are able to speak with authority on issues of common interest. We know that some of our members are not always aware of what we do. They pay their dues because they have to. During my year as president, I hope to see an ongoing change in this area. I look forward to opening channels for discussion and consulting with members from around the province as we move forward with our governance restructuring. It is vitally important that we are united and unified in our objectives. As we have seen in this latest round of negotiations, when we speak with one voice, our goals can be achieved. During our negotiations, there were instances when disparaging comments were publicly directed at the NLMA by a handful of members. We are a democratic organization and members are free to express their opinions, but it definitely tests our unity as an association when these things occur. Ultimately, I believe this dissent can serve to strengthen us as an organization if we can listen to each other with respect and compassion. Even though there are competing interests within our profession, the majority of our members understand that the collective interest is more important for the overall good of the profession. I experienced this personally when I and 13 other salaried specialists announced our resignation in November. I, as well as the other 13 people that resigned, were moved by the overwhelming support and endorsement from our colleagues. We had no idea that the support that we received would be there, and it was truly wonderful. Everyone came together with the understanding that supporting each other is the only way that we will make healthcare in our province better for our patients. Last year, we also witnessed physicians, nurses, and social workers unite around the common cause of improving care for seniors. In March, Dr. Patrick O'Shea hosted a senior summit, which gathered experts in the field of elder care to develop recommendations for the medical treatment of this province's aging population. The final report will be shared with the Department of Health to support the province's long-term care strategy. Following the summit, the association received numerous emails and letters from members praising Dr. O'Shea and the NLMA for being proactive for patients. Dr. O'Shea has inspired myself and others to continue this trend. That is why I plan to continue with an initiative similar to the Senior Summit to hopefully lead positive change.